Acute intermittent porphyria can lead to paralysis and is sometimes fatal. It's hoped gene silencing can also lead to therapies for a range of untreatable diseases. Here's our health and science correspondent, James Gallagher.
We remember both how traumatic it was for both me going through it and for you guys as a family watching me go through it. It was that element for me of the total pain and the sickness and eventually the paralysis and the seizures.
Sisters Liz and Sue have lived in pain that few can imagine. They both have the genetic disease acute intermittent porphyria. Potent opioid painkillers were a feature of their daily life, and Liz was paralysed for 2 years.
One of the times that they had to transfer me from one hospital to another because I wasn't breathing very well at all and I needed intensive care, and Mum was following behind in her car, following the ambulance, and as soon as the blue lights went on, she just crumpled.
I lost it all. It fell overnight. Lost my job, lost my company car, lost everything that I'd been working hard towards, and in a new relationship, not knowing whether my partner would stay with me. He did. We're married. We've got a little girl now, but yeah, it was scary.
Gene silencing therapies get to the root cause of Liz and Sue's genetic disease rather than just managing their pain. They were part of trials here at King's College Hospital, which showed the drug cut severe symptoms by 75%.
So to find a drug that really does transform people's lives is extraordinary, and the first time I've seen it really in my career as a doctor. If we can control genes and switch them off when we want to and switch them on when we want to, then almost anything is possible in terms of treating conditions, including Alzheimer's and cancer and everything else.
So you've been on the drug for a while now. What kind of difference is it making?
The difference is astronomical. We're not in pain anymore and not feeling sick and able to predict life, not having to kind of wait for attacks to happen, which means you're generally more dependable. You're not dependent on opiate-based pain relief, and that leads to things like being able to succeed in a job.
And Sue?
I think being so much stronger, not being in pain, being able to sleep, just being able to plan life a little bit, be able to be a mother better, to be able to be a wife better, and to just live life.
Liz and Sue are some of the first people to benefit from gene silencing medicines, but they won't be the last. James Gallagher, BBC News.